Thank you for participating in Long Beach CHDP's online PM160 training. Today you will learn about who qualifies for CHDP services, how to register patients for CHDP, and billing for CHDP services by using the PM160. Please have a PM160 form and a copy of the most current periodicity schedule ready for reference as you watch this video. Feel free to pause, rewind, and rewatch any parts that were confusing for you. You are encouraged to write down any questions that you have while watching this training and email any unanswered questions to your local CHDP administration office for clarification. There are two categories of children who are eligible to receive CHDP services. 1, those who have full scope Medi-Cal, and 2, those who do not have full scope Medi-Cal. First, those who have full scope Medi-Cal with no share of cost. These patients are not on a managed care plan and are under the age of 21. All patients must be due for an exam per the periodicity schedule. The second category of children that is eligible to receive CHDP services is children without Medi-Cal. These children are not on any insurance that provides well child care. The child's family must meet the 200% federal income guidelines at the time of the exam, and the child must be 19 years of age or younger. As with all patients, this child must be due for an exam per the periodicity schedule. As a provider, you must enroll this child through CHDP Gateway at the time of the exam. Parents of eligible children can access services by calling CHDP administration offices to get the names of local CHDP providers. The parent will make an appointment with your office and will bring with them to their appointment a copy of their BIC or their benefits identification card. Your office will check for current eligibility. If the child does not have current Medi-Cal, the parent will sign the CHDP pre-enrollment application and will request eligibility through the CHDP Gateway. At this point, you can refer to the periodicity schedule that you printed off at the start of the presentation. If you do not have current access to this document, pause the video and obtain a copy of the most current periodicity schedule. As you can see, during the child's first year, they are eligible for 6 exams. Under 2 years of age, they are eligible for 2 exams. At ages 2 and 3, they get 1 exam per year, and at age 4 and older, they receive exams at varying intervals. Children with special needs can be seen once a year. Special needs can refer to the chronically ill, children in foster care, or children who need camp or sports physicals. Let's look at an example of how to use the periodicity schedule. First, you will determine which age category the child fits in. For example, if a child is 19 months old, he falls into the 18-month column, as he is not yet 2 years of age. Now you can look at all the screenings required for this age group. As you can see, the child's next exam is in 6 months. How close to the age marks on the periodicity schedule does a child need the exam? If the child is 2 years or younger, the exam must be completed within 1 month of the age listed on the periodicity schedule. If the child is 3 years or older, the exam must be completed within 6 months of the age listed on the periodicity schedule. Remember, children who are coming into your care that may not be up to date on procedures or immunizations should be brought up to date during their exam. Procedures performed outside of periodicity will result in a claim denial unless they meet the criteria for a medically necessary interperiodic health assessment, or a MNIA. Acceptable reasons for a MNIA include sport or camp physicals, if it has been at least a year since their last exam, a need for anticipatory guidance in the patient or their legal guardian, a history of perinatal problems, or if a child has significant developmental delay, in which case they are eligible for 1 exam per year. Remember, you must write a reason down in the Comments Problems section of the PM160 anytime you perform a MNIA. Another reason to perform a MNIA is if the child is in foster care. Any child placed out of home for the first time must have an exam within 30 days of placement. children in foster care are eligible for one exam per year, unless they have gone home from foster care and then been placed back into foster care, in which case they are eligible for another MNIA. Make sure all this information is documented clearly in the Comments Problems section of the PM160, and that the foster child box is checked. Now we will learn about the CHDP exam. The exam is a head-to-toe, unclothed assessment that includes dental, psychosocial, nutrition, and developmental screenings, in addition to anticipatory guidance. The exam includes a range of immunizations, including the vaccines shown here. It also covers screenings for hearing, vision, anemia, STDs, and other diseases. Recently, the exam also started covering screenings for blood glucose and cholesterol levels. The child must be at risk for being overweight or having heart disease, per a family history. If you choose to perform this screening, the child must have been fasting for at least 8 hours, so make sure you inform the parent or guardian ahead of time. For more information about glucose and cholesterol screening, see Provider Information Notice 5-13 or watch the BMI and nutrition training for CHDP providers. Now that you know a little bit about CHDP and the well-child visit, let's learn more about the PM160, the Confidential Screening and Billing Report. To determine the eligibility of a patient with Medi-Cal, use the information on their Benefits Identification Card, or BIC. You will use a point-of-service device and the Automated Eligibility Verification System, or the Internet Transaction Services for Medi-Cal eligibility. After you enter and print the information from the BIC, look at the printout. It should state that the patient has Medi-Cal with no share of cost. If the patient has share of cost, then you will enroll this child through the CHDP gateway. If the aid code reflects emergency only or pregnancy-related services, then you will also enroll this child through the gateway. Remember, do not attach the printout to the PM160 when you submit it for payment. You will keep a copy of the printout in the client's chart. Fill in the county and aid code in the appropriate boxes on the PM160. That's on the bottom right of the PM160. At this point, you will also fill in the Client Index Number, CIN, from the printout and check box 1 of Patient Eligibility section. If the patient's information does not match that of the printout, you must use the information that Medi-Cal has or your claim will be denied. Note the change in the Comments Problems section of the PM160 and have the patient contact their Medi-Cal worker to change that information. Make sure that all characters land in the letter boxes on the PM160. This form is scanned through a computer that reads your handwriting. If it is unable to differentiate between letters, then your PM160 will not be processed and you will not receive reimbursement. If the patient does not have Medi-Cal, then you will enroll them through the CHDP gateway. You will have the client read the CHDP gateway informative flyer and then fill out and sign the CHDP pre-enrollment application, DHS 4073. Double check to make sure the application is filled out completely and correctly and that it is signed. Make sure that you do not provide the parent with the federal poverty guidelines, as this is considered self-declaration and can harm the integrity of the application. Enter the information from the DHS 4073 into the POS device or the Internet Medi-Cal Transaction Services Gateway screen. Print and read the summary of information and have the parent reread it as well. Correct any errors before submitting it. When the response message comes from Medi-Cal, run the information through the eligibility determination system to confirm patient eligibility. Write in the county code, the aid code, and the CIN on the PM160. If the aid code is 8W, 8X, 8U, or 8V, check box 1. These patients are eligible for presumptive Medi-Cal. If aid code is 8Y, check box number 2. These patients are eligible for CHDP services only. Once entered into the Gateway system, children with codes 8U and 8V have full scope Medi-Cal for 1 year from their date of birth, and there is no need to complete a joint application. This means that all referrals and other services are covered by Medi-Cal. Codes 8W and 8X should be referred for any necessary treatment services immediately because their temporary full scope Medi-Cal ends at the end of the second calendar month. These patients should be referred to a local, single point of entry certified application assistant, or should be encouraged to complete the joint application DHS 4073 as soon as possible. Of course, if the condition is a California Children's Services medical condition, they should be referred to CCS immediately. It is important to check the eligibility of any child before seeing the child on Medi-Cal or enrolling the child through the CHDP Gateway. We will now discuss the patient information section found at the top of the PM160. Once a child is determined to be eligible for a CHDP exam, you will fill in the top of the PM160 using block letters, meaning all uppercase and no cursive. Remember to put 1 letter per letter box on all areas of the PM160. Make sure that all information matches the information on the Medi-Cal printout or on the pre-enrollment application. Next, you will verify that the patient's birth date matches that on the Medi-Cal printout or the DHS 4073. If it doesn't match, make sure to write in the age in the system and write the correct age in the comments or problems section. For children over 2 years, enter the age in years. If the child is 2 years or younger, enter the age in months. Also, you should make sure that the gender matches the information on the Medi-Cal printout or on the DHS 4073. The county of residence is where the patient lives, not where the clinic is located. The code for Long Beach is 62, and the code for Los Angeles is 19. You will then enter the telephone number. Every PM160 should have a phone number listed. This is the easiest way to get in contact with a patient. If the patient refuses, however, write a 0 or none. Calculate the next well-child visit date per the periodicity schedule. If the child is under 3 years old, enter this date including the day. If the child is over 3 years old, write just the month and the year. If you cannot project more than a few months ahead for scheduling appointments, just add the required interval plus 1 day between visits to determine the next exam return date. Write the responsible adult's first and last name and address, the patient's ethnic code, and the date of service. Now we will learn about completing the CHDP assessment and how to document these results. Locate columns A, B, C, and D on the PM160. They are located in the middle left of the form. Don't forget, there must be a result for each screening procedure. Keep in mind that the examiner must fill out numbers 1 through 5. Office staff may fill out the remaining procedures. Column A is no problem suspected. Checking this box means that the assessment was done and that the outcome was normal. Column B is refused, contraindicated, or not needed. Checking this box means that no procedure was performed. No fee should be billed for a procedure if this box is checked. If a procedure is required for the age of a child, you must write an acceptable explanation for not performing the procedure in the comments problem section.